So HICCup is a contest in one sense. It's 5 places, 5 metrics, 5 years, and it's 5 communities competing to show the greatest improvement in health according to these 5 metrics, which range from the medical to things like unpaid time off over 5 years. And the ultimate goal is to have a prototype for what happens when you really do all these things at the same time. Healthy eating, more exercise, better care management for chronic disease, and better acute care in hospitals that saves money. So when you do all of these things together, obviously if people are eating right, it's going to be easier to manage a population of diabetics. And it's going to have real impacts both on people's health, but also kind of on the community measures of employment, school attendance, everything. Health is not a passive thing, it's a positive, active thing. And we're trying to help communities produce that and then gather data up the wazoo so that other people can look and learn and be inspired and do it at a bigger scale in places that are not these kind of isolated microcosms where it's easy to collect data. The reality is it's much easier to do this in a 50,000 member community that's relatively enclosed than it is to do it in a suburb of Newark. But once you see what can be done, then you say, boy, we could do this. And let's look at their numbers. Let's see what interventions they tried, what worked, what didn't work. Because our whole goal is to be very open and basically create evidence-based health as opposed to evidence-based medicine.
The interesting part about participating here was really coming and keeping our finger on the pulse of what's going on within the industry, seeing companies from all different parts of the healthcare sector.
mHealth is the epicenter of all the action, brings everyone together. It was good to pitch to venture capitalists, investors, angels, all that stuff, so it was great.